My name is Dr. Yakub, Well-Life Hospital Abuja. Today, we're here again to talk about something very important in our series of health talks. We think it is important because its impact on our collective health, and that is about drug resistance. Now, what is drug resistance? We see that when we talk about drug resistance, a lot of people imagine that drug resistance means their body resisting the effect of the drug. That is not what drug resistance is. So the extent that you see a lot of people, you want to prescribe a particular medication, they will tell you that this does not work for me because my body is resistant to it. That is not what drug resistance is all about. When we talk about drug resistance, what it means is that in this case, actually, we are talking about the effect of the drug on a particular microorganism or particular germ. There are different types of germs that tend to affect human health, and we have in this group, we have bacteria, we have viruses, we have parasites, and then we have fungal organisms. All of these things at different times in different situations can affect human beings, and when they affect human beings, we say there is an infection. Now, any one of those organisms has a potential to resist medications, and when they resist the medications you are using, then we say that that organism is resistant to the medication you are using, and that is what drug resistance is all about. So it is not about your body resisting the effect of the drug. Rather, it is the organism in your body that resists that medication, so that when you use that medication, it does not work in terms of clearing the organism from your body, and at which time you have treatment failure. In other words, the organism does not clear because it is resistant to the medications you are using. Now, how does drug resistance come about? There are various reasons why drugs or organisms, as it were, become resistant to the drugs. One common reason, especially in this part of the world, is the use of substandard medications. Now, when we say substandard medications, it's slightly different from fake medications, and I will try to differentiate the two. Now, when we say substandard medications, what we mean is that the drug is not, the medication does not contain the appropriate amount of the active ingredient that medication claims to contain. Let's say, for instance, paracetamol. I'm just giving that as an example. If I have a substandard paracetamol, though it looks white as paracetamol, maybe the company that produced that substandard medication, half of that paracetamol, let's say it's supposed to give me, let's say 1 gram, so to say. I'm sure we're all familiar with those measurement distance. If it's supposed to contain 1 gram of paracetamol, but the company rather puts maybe half gram of paracetamol and the rest is probably chalk, that paracetamol is considered substandard because it does not contain the appropriate amount that it's supposed to contain. So in that case, if a drug, for instance, that is meant to kill a particular germ in your body, there are appropriate doses for different disease conditions and different age groups. So if a doctor prescribes a medication that's supposed to contain, let's say 1 gram of that medication, and that is the amount that is supposed to kill the organism, but the drug contains less than that, of course, the organism will survive it. And usually, organisms have this adaptive behavior. Once they survive a particular onslaught, once they survive a particular medications, even when eventually you now use that appropriate dose later, after it has survived, the organism changes its body in a way that it will resist the drug next time. So the use of substandard medications in this regard can infer resistance to the drug by the organism. That is one way drug resistance comes about. The second way, of course, drug resistance comes about is fake drugs, of course, where in this case, the drug itself is not even what it's supposed to be. And so you are exposing the drugs to something else, that you're expecting to kill. So you find out that the drugs does not work. Then drug abuse. Now, sometimes the medication you are using may be right, but you did not, maybe your doctors or your professionals have prescribed the appropriate drugs, but when they tell you to take the drug maybe for 5 days, or as it were 2 days or 3 days or 1 week as it were, but after using the drug for a day or two, you felt better and you feel that, you don't need the drugs any longer, and so the remaining organisms that left to be cleared out by that medication, by continuing the dose, you did not completely. So you have left some of the organisms that survive the exposure to the medications. So thereafter, those ones, the few that survive the medications, will eventually become resistant to that particular drug. And sometimes when you expose yourself repeatedly to have or substandard dosing of particular drugs across different types of medications, you find out that you eventually expose that organism to these substandard doses, and ultimately the organism becomes resistant to a variety of medications that you have not used appropriately. And so at the end of the day, the organism survives in your body, and sometimes that same organism may find itself in another person, and in which case, whatever it is that you have exposed yourself to in substandard manner will not work in the other person. So, and that is when we say that that individual who now has a new version of that organism in him or her has drug resistance. That is, the organism in him or her are resistant to the medications you're using. One very common example that we come across is malaria resistance. All right, I'm sure all of us have this experience where we go to hospitals and then they give you anti-malarials one after the other, and the drugs don't seem to work. Of course, the reason for this is because the malaria parasite has been exposed to a variety of medications over time, and sometimes because of substandard nature of medication, sometimes because we don't complete our doses appropriately, we leave some of the malaria parasites behind after treating for a few days. Okay, and those ones that survive the onslaught now eventually become resistant to every and all the anti-malaria that you have abused or you did not use appropriately. So therefore, at the end of the day, the malaria parasite becomes resistant. Now, what happens when we have drug resistance is that everybody in that environment in which we have organisms that are resistant to medications around, everybody has a risk of treatment failure when such happens. And so that is what is actually happening in the case of malaria parasite. Now, WHO has actually officially declared that almost all anti-malaria molecules, that is, almost all anti-malaria medications in existence, malaria is resistant to them. And the reason is because of widespread misuse of anti-malarials, And so because the malaria parasite itself is has become smarter than us, and it has now become resistant to practically everything that is available, because we either are not using the appropriate medications at the appropriate doses, or for some reasons we're not getting standard medications to use, and so the parasite does not die from the medication. So please, it is important that we have this at the back of our mind. Now, how do we deal with drug resistance? Each and every one of us has a role to play in this. Of course, there is a level we cannot do anything about, because at the pharmaceutical levels, we can't do anything about. We're not the ones that produce drug. That is probably where governments and regulatory agencies come in, because they need to put up their searchlights on all the time and make sure that there's a continuing search, and evaluations of medications that are claimed to be what they are. there's a need for our regulatory agencies and government to make sure that yes, indeed, those drugs contain what they are said to contain, so that we are not exposed to substandard medications that may eventually expose us to drug resistance. So, but beyond that, as individuals, what is our role? What can we do? Of course, first is to make sure that every time you use a medication, especially drugs that are meant to kill germs, bacteria, parasites, or like malaria is a parasite, or fungal infections and all of like yeast and all of that commonly in women, anytime we are supposed to use any one of these medications, please let's be sure that we use the drugs as prescribed by our physicians up until the last dose, please. Because the reason we do that is even when you start feeling better, sometimes there is still some element of the bacteria. After all, before you even became sick, you didn't know at what point the organism got into you. And so there's some element of residual microorganisms even when you begin to feel better. And that is why sometimes you have extended dose regimen. So it's important that you complete your medications as prescribed by your doctors so as to avoid the organism in you becoming resistant to the medication, so that you don't spread that organism to other people who did not abuse the drugs, because that's the consequence ultimately. That particular organism may leave you and get into another person, and before you know it, that person has a drug resistant organism in him. So by and large, we have both collective and individual roles to play in trying to make sure that we avoid drug resistance. Please don't also self-medicate, because that is one way drug resistance also come about. So thank you very much.